Hi everyone, my name is Dr. Shiva Hadadianpur and today I'm going to talk about morning sickness in pregnancy. So what is morning sickness? Morning sickness is the term that is used to describe mild nausea and vomiting in pregnancy. Even though symptoms usually occur throughout the day and even at night, morning sickness often develops by 5 to 6 weeks of gestation, and for most women, it goes away by 14 weeks of pregnancy. And for a few women, it lasts throughout the pregnancy. Is morning sickness a good sign or a bad sign? The good news is that it might be a good sign. Studies have shown that pregnant women with nausea and vomiting during the first trimester have a lower risk of miscarriage compared to women without morning sickness. What causes morning sickness in pregnancy? Scientists are not completely sure why it happens. It seems that pregnancy triggers the specific part of the brain that controls vomiting. It may also be caused by dropping in blood sugar or the rise in pregnancy hormones such as estrogen. It can be aggravated by stress, tiredness, eating certain foods, or being sensitive to motion. For coping with morning sickness, we suggest that you stay in bed for 15 minutes after you wake up. Nibbling a little bit salty crackers before you get out of bed in the morning can stave off nausea. Note that every cracker is not alike. The saltier, the better. Eat frequent small meals rather than 3 large meals, as an empty stomach tends to trigger nausea. Keeping your tummy a little bit full all day and all night is the best defense against morning sickness. Try to drink a lot of fluids. Water is best, but sometimes sips of carbonated drinks like ginger ale or 7-Up, flat lemonade, diluted fruit juice, or weak tea will help settle your stomach. If none of these is bearable, try sucking on ice cubes. You may need to drink fluid between meals rather than with them. Avoid sensory stimuli, such as smells that make you feel worse. Don't take drugs of any kind unless your doctor knows you are pregnant and prescribes specific medications. A diet high in carbohydrates, I mean starch, is often the easiest to tolerate. Try toast, crackers, bagels, rice, potatoes, and whatnot. They are less likely to trigger morning sickness. The starch can also absorb stomach acids to relieve a raunchy tummy. High-protein foods such as beef, poultry, fish, and eggs can keep nausea at bay while replacing your energy. Avoid spicy, greasy, and fatty foods. If you have morning sickness, don't forget the lemons. Sniff them, squeeze them in drinking water, or even lick slices. The smells and taste soothes your stomach. Ginger may relieve morning sickness after using for a few days. You can take ginger in the form of ginger capsule, or grate fresh ginger in hot water and use it as a tea. But note that consumption of too much ginger can cause constipation and worsen your situation. Pretzels and plain potato chips calm your nausea because they are salty, non-acidic. easy to digest and require minimal effort from your digestive system. Avoid cereals that are jam-packed with added sugars. Instead, one that's fortified with minerals and vitamins for some added nutrition. Vitamin B6 is a popular and pregnancy-safe nutrient that can help with morning sickness. Increasing your dietary source of B6, such as beef, chicken, salmon, nuts, chickpeas, pistachios, spinach, turkey, potatoes, bananas, and plenty of vegetables might help relieve your morning sickness. When eating and keeping food down is a struggle, broth settles your stomach quickly and rehydrates you better. It also contains electrolytes to prevent dehydration. Bone broth is one of the best sources of calcium, magnesium, and phosphorus that we need during pregnancy. The minerals that are dissolved in broth play an important role in fetus development. A good strategy to overcome nausea and vomiting in pregnancy is to try to distract yourself. It's not easy to ignore morning sickness, but finding something to distract you might help. Nausea eases off when you don't think about it. Read a book, listen to music, play chess, do a puzzle, or go for a short walk. Walking is a safe and simple way that helps you boost your mood and energy level. But if you start feeling tired, it's time to stop. An increased sense of smell is very common in pregnancy. This means the smells you never noticed before are overwhelming. Actually, many pregnant women report gagging or becoming ill over smell in the area. In fact, smells that you once loved may give you a headache or make you want to vomit. It may show up as soon as a few days after conception, even before you miss your period. For coping with smell aversion during pregnancy, first of all, it's better to avoid scents that drive you crazy. Heat your foods in the microwave because in this way, few odors will be produced. Chewing peppermint gums or sucking peppermint candies can take your attention away from odors. You may tolerate cold foods better than warm dishes because they don't have strong odors. Try to surround yourself with pleasant smells like mint, lemon, peppermint, or cinnamon. Peppermint oil has been found to be safe in pregnancy, and applying a small amount inside the nostrils may help to block out offensive smells. Protecting your teeth from frequent vomiting is important. You should avoid brushing your teeth right away after vomiting because the stomach acid causes some of your tooth enamel to wear away. Make sure you rinse your mouth with water, then with mouthwash, and after about half an hour, brush your teeth as normal. While it is easy to attribute any type of nausea and vomiting to morning sickness, the problem might actually be due to thyroid or gallbladder disease, food illness, or even peptic ulcer. Some pregnant women develop severe form of morning sickness called hyperemesis gravidarum. This is a serious condition during which there is a chance that you may not get enough fluid or nutrients from your diet. This happens in up to 3% of people who are pregnant. Signs and symptoms of hyperemesis gravidarum include vomiting more than 4 times a day, vomiting that leads to dizziness or lightheadedness, vomiting that leads to dehydration. Dehydration is a common side effect of severe vomiting. Signs and symptoms of dehydration include feeling thirsty, having dry mouth, sunken eye, or racing heartbeat, or making little dark urine or no urine at all. Losing more than 10 pounds in pregnancy could be another sign of dehydration. Most cases of hyperemesis gravidarum occurs in first pregnancy, but women who have it in one pregnancy are more likely to have it in future pregnancies. It also might run in families, and it is more common in women whose mother or sister had severe nausea and vomiting of pregnancy. Other risk factors that increase the chance of experiencing hyperemesis gravidarum are having a multiple pregnancy, like twins or triplets, having a history of motion sickness, migraine headaches with nausea and vomiting. Medication for morning sickness is usually the last resort. You should try non-medical options before using medications. Even though there are some products available over the counter, you should always communicate with your practitioner about your symptoms and any product that you plan to take. As far as we know, vitamin B6 is a safe over-the-counter treatment that may be tried in case of morning sickness. A prescription drug that combines vitamin B6 and doxylamine is also available and has been found to be safe. If you're really struggling and available over-the-counter pills haven't helped, your practitioner may decide that antiemetic drugs are the best options for you. In severe morning sickness, nausea and vomiting are so extreme that the mother is not able to keep down food. So she can't meet her nutritional needs, and loss of fluid combined with loss of stomach acid from vomiting leads to dehydration and electrolyte imbalance. In this situation, the pregnant mother will be admitted to the hospital and take IV fluid and IV antiemetic medication until her symptoms are under control. Thank you for your attention.